Hello and welcome to this video. In this video, we're going to discuss about risk assessment for full mouth reconstruction cases. I teach a lot of dentists doing full mouth reconstruction and I mentor them sometimes one-to-one. And they all ask me, which is the best case, which is the best first case to start full mouth reconstruction journey. So I've made this video to show you or to share with you some of the tools I use or some of the risk assessment tools I use for the dentist, so then they don't get into trouble and they can select the cases properly. Let's look at some of the factors which can affect your decision making, and you can sort out the case between low, medium or high risk patient. First factor is patient expectation. This is the key. You want patient to be understanding on your side, and you need to be able to get on with the patient very well when you're doing full mouth reconstruction. It's not like doing a single filling. You're going to see patients a lot, and you need to make sure you get on with the patient very well. And patient needs to understand what they are getting into. If anything, I would scare the patient from the beginning. I would give them all the horrible stories because I want to make sure that they trust me to do that treatment. So if patient expectation is low, then low risk, medium risk. If patient expectation is high, then it's a high risk, and you really need to think whether it's worth taking on that patient or not. The second thing is their smile line. If patient's got really high smile line and patient showing everything, then obviously it's a high risk. Compared to the patient with a low lip line and low smile line, it's a low risk patient. Overall condition of the teeth. If patient just got pure wear and there are only a couple of teeth which are restored, then that patient is restoratively aspect wise easier to treat, where patients got multiple crowns, onlays, post-encore crowns, implants. And if patients got all that and now you're doing full mouth reconstruction, then it becomes a bit more complex and it becomes more high risk patient because you are now involving multidisciplinary issues. We discussed in previous video that type of tooth wear is really important. If patients got erosive wear, then those patients are much easier to treat or predictably treat than patients with attrisive wear. Patient who has attrition, they have grinding, they box their teeth, there is highly likely they're going to break things, or they might have muscle issues, TMJ issues. So make sure that you assess if your first case is erosive case, then great, because they tend to be more predictable. The other unique thing you need to assess is whether the teeth are aligned. If the teeth are nicely aligned in a normal position, then that's low risk. If the teeth got severe crowding, severe inclination of the teeth, then it's a high risk case because you first need to move the teeth into the right position, then maintain them, retain them while you're doing full mouth reconstruction, and that can become tricky. So make sure that you assess patient's occlusion and the alignment of the teeth. Occlusal plane, if patient's got flat occlusal plane, upper and lower, then it becomes much easier than if patient's got a high and low occlusal plane. If patient's got canted occlusal plane, then it's the highest risk. If patient's got up and low down, then occlusal plane, then yes, you can do gingivectomy, crown lengthening, increase the crown. But if patient's got canted occlusal plane, then it's much more difficult to manage, and patient may need some heavy orthodontic treatment to correct the cant before you start doing any treatment. And lastly, if patient's bite force, if patient's got normal muscle size and bite force, then it's again low risk, versus if patients got large muscles, patients got really heavy force when they're biting their teeth, then you know that your restorations are at risk and you need to give them some sort of a protective shield or a Michigan splint or some sort of a protective appliance to protect your restoration. And even in that case, patient may still damage the teeth during the daytime. So I hope you found this video useful in assessing the risk assessment for full mouth reconstruction cases. If you have any questions, please feel free to contact me.